Lawrence Patihis's commentary in the journal Behavioral and Brain Sciences in 2015 critically examines the claims made by Lane and colleagues in their article called Memory Reconsolidation, Emotional Arousal, and the Process of Change in Psychotherapy. Patihis urges skepticism towards the idea that high emotional arousal is a causal factor in positive therapeutic change and questions the application of reconsolidation research to therapy. Lane and colleagues suggest that emotional arousal during therapy is beneficial for therapeutic outcomes. Patihis challenges this assertion, arguing that cognitive behavioral therapy or CBT and exposure therapies do not necessarily aim for high emotional arousal, yet they are effective for various conditions. Patihis cites studies indicating that emotional arousal is not a significant predictor of therapeutic success. For example, Jaycox et al. Found that gradual habituation to exposure therapy, rather than high initial emotional arousal, led to better outcomes for PTSD patients. Reconsolidation research is a fascinating area. Nevertheless, Patihis urges caution about applying this basic research to therapy. He points out that the foundational studies on reconsolidation often involve animal models and fear responses to electric shocks. These are not directly applicable to the complex autobiographical memories that come up in therapy. He really emphasizes the need for caution when extrapolating from basic neuroscience to therapeutic practices. And he highlights the ethical concerns of manipulating memories in therapy. Memory distortion. The commentary discusses the phenomenon of memory distortion and its potential implications for therapy. Patihis argues that changing memories may undermine a person's ability to predict future events accurately and could be unfair to individuals involved in the client's revised memories. Patihis questions the ethicality of memory manipulation in therapy, suggesting that it may not be beneficial and could have negative consequences. Patihis critiques the promotion of emotion-focused therapy by Lane and colleagues in their article, which involves re-experiencing early traumatic memories and focusing on the emotions that arise. He warns against conflating evidence for different therapeutic approaches and urges careful consideration of the implications of high emotional arousal in therapy. Patihis's commentary calls for open-minded skepticism towards the claims made by Lane and colleagues about emotional arousal and reconsolidation in therapy. He advocates for a cautious approach to incorporating these concepts into therapeutic practices, emphasizing the need for robust evidence and ethical considerations.